very good. So what do I do? So I give them ivermectin still. Till today I am
Mhm.
using it in 12 milligram per day. I give it usually for 3 days. I give a broad spectrum antibiotic. My choice is azithromycin, but I could give doxycycline also. And then follow them up. Uh, None of these drugs, whether HCQ or ivermectin or azithromycin or doxycycline, has altered the course of mild disease. It has not prevented mild disease turning into severe disease. They do cause side effects. There is no drug on this earth which does not cause side effects. So one has to be careful. Sometimes these people get diarrhea and pain abdomen. You may say that it is because of corona, but actually, quite often, it is because of the drugs that they develop this.
Uh,
So, if as far as uh, indication for hospitalization, as I said, that unless there is a shortage of beds and you are not able to get anybody who is requiring oxygen, should be in hospital. That is the most important parameter that one should be taken. Besides that, if there is altered level of consciousness, or if there is respiratory rate is more than 30 per minute, or if the blood pressure is going down, these are the parameters. And the people who have got severe comorbidity, like those are 75 years plus, or have got diabetes, or who got cancer treatment, or rheumatological diseases, immunosuppressed, interstitial lung disease, underlying structural lung disease. If they have corona, if they want to be 100% safe, they should not be at home. In the previous outbreak, we always kept them in the hospital, but sometimes we have to do rationing, so we keep them at home and monitor them from a distance. But generally, these patients should be in hospital. So summarizing it, oxygen most important, level of consciousness number two, feeling of shortness of breath, difficulty in breathing, respiratory rate more than 30, or heart rate more than 20 without fever. Without
yeah.
fever would be an indication for putting them in. Called long COVID and chronic COVID. There are two types of complications that we see. One is, say, within 30 or 45 days, that is post COVID hyperimmune syndrome. Patient recovers, goes home, and within, say, 1 or 2 weeks, he comes back with fever, difficulty in breathing, low oxygen, and new shadows come into the CT scan. And if you do PCR, sometimes the RT-PCR is positive, sometimes RT-PCR is not positive. So in that case, it is treated almost like a new COVID infection, and we give steroids. Sometimes in the serious cases, we also give second course of remdesivir, even when the PCR is positive or not. In some cases, in the serious cases, when they go home, come back, their RT-PCR remains positive. Now I'll give you one case from Cleveland Clinic when they did a lung transplantation in patients. So the lung which was taken out from the recipient, that means after almost 3-4 months, when they cultured that lung, the virus was still alive in those cells. So it's not that virus is always dead in 10 or 14 days time. In
Yep.
some cases, the virus will be alive for weeks or months together. This is about the acute illness. The long COVID, the long term side effects involve any system. It could be lung in the form of lung fibrosis. These people have difficulty in breathing on exertion, climbing stairs. And if you do the pulmonary function, their vital capacity is diminished. If you do their 6-minute walk test, their their walking distance goes down, their oxygen saturation go down, and then you do a CT, you can see a changes of lung fibrosis. The most common symptom after COVID is fatigue. Now, this fatigue can continue for months. During SARS 1, which happened almost 15-20 years back, 3 years later, when they phoned up these patients, 40% of the patients who had recovered from SARS complained of fatigue. And that is what I am also seeing, that people are 2 months down the line. They say by evening they get so tired, they feel like lying down, they don't feel like doing anything. Although they are, I mean, they have no fever or something. Besides that, sleep disturbances are very common. Emotional disturbances are very common. People get up in the middle of the night in the panic. There's also a symptom of cognitive dysfunction some people have, which continues for a longer time. Some people have cardiac uh, events. Some people have dropped dead while exercising after the corona, and they have found clots in their coronary arteries. Kidney and liver is not much affected, but neurological finding like cognitive dysfunction, dementias, early dementia is also signs are also seen. So these patients need to be followed very sympathetically.
Okay.
From the doctor's point of view, one should not discount their symptoms. They actually